Okay, my name is Hannah Hill. This is my final head-to-toe assessment for Nursing 7116. This is my patient, my brother Ryan. We have already done his vital signs. We've done his blood pressure, pulse, respirations, temperature, height, and weight. His visual acuity was tested with the Snellen chart and is 20/20, which is also cranial nerve 2. And now we will proceed with the rest of the head-to-toe assessment. Okay. So the first thing I'm going to do is I'm going to just look at your scalp. So if you just tilt your head down, okay, and I'm looking for any lesions or scarring or any visible masses. I do not see any. So now I'm going to palpate the head. Tell me if you feel any tenderness.
No.
Okay, no tenderness. I also don't feel any lesions, masses, again, scarring. The hair is average texture and distributed normally throughout the head. And the head is normocephalic and
abnormal.
and then there's no fogginess.
Right.
Okay, so now I'm going to palpate your sinuses and let me know if you feel any tenderness. Do your frontal.
Nope.
Okay, and maxillary.
Nope.
Okay, no tenderness. All right, so the septum is, well, let's talk about your eyes first. The eyes are symmetrical bilaterally. The eyebrows, the hair is distributed evenly. The eye, around the eyes, I don't see any redness, any swelling, any nodules, any exudate from the eyes. And the eyelashes are distributed evenly on the upper and lower eyelids. I don't see any, open your eyes, any occlusion of the lacrimal ducts. The sclera is white, the conjunctiva is pink. Just look at me. Okay. And the iris markings are well defined. The pupils are round, approximately 3 to 4 millimeters, and they are reactive to light. And the light reflex is nasally to the center of the pupil. Okay, I'm going to go ahead and look in the eye. Okay. Oh, no, it went into your face.
You're
okay.
Fine.
The optic disc I can see is a orangish yellow color. The disc margins are sharp. I don't see any hemorrhaging or exudate. Okay, and I do see the red reflex. Okay. The septum is midline. There's no deviation. I'm going to occlude one side of your nostrils and ask you to breathe, okay? Breathe. And breathe. Good. Okay. The nares are patent. I'm also going to go ahead and look in your nose. Okay. The nasal mucosa that lines the septum and nasal turbinates is pink and appears moist. There's no swelling, bleeding, or nasal polyps. Okay. I'm going to palpate your ears, and I want you to let me know if you feel any tenderness.
No.
Okay. Other ear.
Mm-mm.
Okay, the auricle is not tender. I'm going to go ahead and look in the ear. And let me know if you feel any tenderness.
No tenderness.
Okay. The tympanic membrane is pearly gray. And I do see the malleus. There is a reflection of light on the cone at 7 o'clock in the patient's left ear and 5 o'clock patient's right ear. Okay. I'm also going to palpate your temporomandibular joint for any tenderness. Okay. Patient's lips are moist, pink. I don't see any dryness, any lesions around the mouth. I'm going to ask you to just open mouth for me. Okay. The buccal mucosa and soft palate is pink and moist. The patient's tongue is pink and moist with papillae distributed normally on the anterior portion, and just lift your tongue for me. Oop, turn my light off. Okay, and smooth on the posterior portion. Dentition is good. There's no missing teeth. Okay. I'm going to test for lateralization. So I'm going to tap my tuning fork and I'm going to put it in the middle of your head, and I want you to tell me if you hear or feel the vibrations on both sides, okay?
Okay. Yeah.
Okay. And I'm going to do this again. I'm going to put it on the mastoid bone behind your ear, and I want you to tell me when you stop hearing it, and then I'm going to put it in front of your ear and you tell me when you stop hearing it.
Okay.
Okay.
About now. It's still going strong there.
Yep.
Just the never-ending sound. Still going. Still here.
Okay, well,
right there went.
Air conduction is definitely longer than bone conduction, and that is good. So we don't have any hearing loss. I would do this bilaterally. Okay. Now I am going to ask you to like I don't know. Okay. I also want to talk about the patient's skin on his face. Skin is appropriate for ethnicity. I don't see any lesions or scarring of the face, and color is distributed evenly throughout. Okay, now I'm going to look at your neck. Again, skin color appropriate for ethnicity. The color is good throughout. I don't see any lesions, any enlarged organs or nodules that are visible. I'm going to go ahead and palpate your carotid artery. Good, okay. Upstrokes are brisk, and rhythm is, our rate is 2+. Let's see. Also, I'm going to go ahead and palpate your trachea. Okay, trachea is midline. Again, I don't feel any nodules, any masses. I don't see, just do the first button right here just so I can just see right here. Okay, I don't see any jugular vein distension. Okay, now I'm going to ask you just tilt your head slightly. You can go ahead and let go of your shirt. And swallow. Okay, and one more time. Okay, and I'm going to palpate the thyroid. Okay, and swallow for me. Good, and one more time. I'm not checking. Okay, good.
I just needed to get something to generate some saliva or something.
So no nodules or enlarged organs are palpated. I'm going to go ahead and look at your shoulders. I don't see any muscle atrophy. I'm going to palpate the joints, and I want you to tell me if you feel any tenderness.
Should be like a rock there.
Yeah, that's rock hard.
No tenderness.
No tenderness. Okay, good. Okay, and I want you to put your arms out in front of you. Put your arms out behind you. Arms out to the side. And then just put your hands by your side again. Put your arm out like this and do it back and forth. Okay, and then put your hand behind your head like you're going to brush your hair. Okay, get a little further. Yeah, kind of like whatever those exercises are called. And then reach and try to scratch your back. Okay, good. And the other arm. Okay. Range of motion is full and expected. Okay. Now we're going to, I want you to bend your elbow for me. Okay, both elbows. Okay, and put them back down. Okay, and I want you to turn your palms up to the ceiling. Turn your palms down to the floor. Okay, good. And bend your elbow again.
Yes.
And as I pull, you pull back.
Okay.
Okay. And I'm gonna push and just bend your elbow again and push. Okay. And the other side and push. Good. Okay. And now I want you to put your hands back out in front of you. I want you to point your fingers to the floor. Point your fingers to the floor.
Oh, like this.
Yes.
Okay, gotcha.
And then point your fingers to the ceiling.
Okay.
Okay, good. And then put your hands flat again and point your fingers to the midline like this.
Okay.
Okay, and then away from the midline. Good. So we've done flexion, extension, and we've done ulnar and radial deviation. Okay, and then I'm also gonna put your hands up one more time and test strength. So bend your wrist up and push against my hand, and down, push against my hand. Good. All right. Use your hands one more time. Sorry. I want you to make a fist. Put your hands back out. Spread them apart. Put them back together. Okay, good. And then put your hands towards me. Do your thumbs in and out. Test for opposition. So I want you to touch your thumb to your pinky. And then touch each finger like this. Good. All right. And then one last thing. Do your thumbs like this. Like towards the front. Perfect. Okay. And then grab my hands just for strength. Like grip my hands.
Grip it.
Yeah.
Gotcha.
Okay, good. All right, so strength is 5-5 throughout. Range of motion is full and expected. I'm trying to think of anything else. Okay. Also, inspecting the patient's arms. I do know a tattoo to the patient's right upper arm and to the patient's left lower forearm. Skin is warm and dry to the touch. I don't see any lesions, any scarring or any nodules or any abnormal masses. Okay. I'm going to go ahead and palpate your elbow. Okay. Feel any tenderness at the epicondyle. And I'm going to palpate for epitrochlear lymph nodes. Okay. Again, any tenderness? Okay. All right, so we've already done range of motion, and also I'm going to look at your hands. So, good. All right, turn your hands towards the floor. I'm going to palpate for any bogginess, any tenderness. I don't feel any bogginess. Is there any tenderness? All right, I don't see any muscle atrophy. Move that watch just a little. Okay, and no bogginess or tenderness. Okay, or any unusual bony any unusual bony structures. I always want to say prominences and not correctly. Okay. Now I'm going to ask you to close your eyes, and I'm going to ask you to tell me what you smell.
Alcohol.
Yep. Okay. So that is, you can open your eyes. That's cranial nerve 1. I'm going to ask you to, this is what I want to do first too. All right, just keep your eyes open and cover this eye, this one, and back to this one. One more time. Okay, I don't see any ocular deviation or strabismus. Let's see, and I talked about the red reflex. So now I want you to, I want you to cover one eye, doesn't matter which one. Okay, and I'm gonna close my left eye since you're covering your right, so I can see what you're seeing in your field of vision, if that makes sense. I'm gonna hold my fingers up, and I want you to tell me how many fingers I'm holding up, okay?
Okay. 1, 2, 1, 2, 3.
Okay, and then tell me when you can see my fingers. Don't, but keep looking at me.
I can see them.
Just
I
tell me
see
which
'em.
one.
Yeah.
You tell me.
I see them. Yeah, I
Do you
see
see
them.
them? Okay,
I
let's,
see 'em.
let's do the other eye.
Okay.
All right, again.
1, 2, 1, 2, 1.
Okay, and tell me when you can see my fingers, okay?
I can see them. I can still see them. I'll let you know if I can.
Okay,
So far, so good.
good.
Yeah, I can see them.
All right, good. All right, so we're testing for cranial nerve 2. I don't see any, this cranial nerve 2 for confrontation. Okay, so now I'm going to just look straight at me. Good. Good, and one more time. Okay, so direct and consensual reflex is positive. And I want you to look at the pen and then look at the wall. And look at the pen and look at the wall. Okay. So we're looking for convergence and accommodation for cranial nerves 2 and 3, and these are intact. Of course, I can't physically see accommodation since it has to do with the ciliary muscles, but I know you can see the pen in your side. Okay. I'm going to ask you to follow my finger without moving your head, okay?
Okay.
With your eyes.
My bad.
Yeah,
I got
it's
you.
okay.
I'm with you.
Sorry. Didn't give great direction. Okay, so we're looking for extraocular eye movements. I don't see any nystagmus, and that's cranial nerve 3, 4, and 6. Okay, now I'm going to palpate your temporal muscle, so I want you to clench your teeth. Okay, and again, let go and clench again. All right, now open your jaw. Move it side to side. Okay, good. So masseter muscle strength is good. This is cranial nerve 5. Also, I don't feel any crepitus at the temporomandibular joint. Patient doesn't report any tenderness. I'm going to ask you to close your eyes and tell me when you can feel me, if you can feel me touching your face, okay?
Yep. 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 Yep.
Okay, good. And one more time. Close your eyes.
Yep. Yes. 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 Yes.
Okay, good. And then close your eyes one more time. And tell me when you feel me touch.
Yep. Yep. Yes. 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 Yep.
Okay. Close your eyes.
Okay.
Sorry.
Yes. 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 Yes.
Okay, and we're going to do it one more time. So keep your eyes closed.
Yes. 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 Yep. Yep.
Okay, and I would do this, you can open your eyes, down the legs bilaterally, but the pants may deviate from what you would probably normally feel. I'm also going to go ahead and you tell me if you can feel the vibration when I touch your skin, okay?
Okay. Yes. 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 Yep. Yep.
Okay.
Yep.
Back.
Yep.
Good. Okay, and let's do this 2 times. You should be able to feel it.
Mm-hmm. Mm-hmm. Yep.
Okay, good. All right, so we have positive pain sensation, as well as you can feel the vibration. Okay, so we'll do, and I did 5. So we did the rest of cranial nerve 5. Now I want you to, let's just move on. So I'm going to whisper something in your ear, and I want you to tell me what I say, okay?
875.
Don't wait for the next one.
No, you did not say Go War Eagle.
Okay, on the record, this is a diehard Georgia fan.
I really heard you say that.
But he heard what I said.
I heard you.
Okay. Okay, so that's cranial nerve 8. Auditory acuity is intact.
I don't think I've ever said that. Ever.
I won't tell anybody. It's great. Okay, so I want you, I'm going to go ahead and want you to open your mouth and say ah.
Ah.
One more time.
Ah.
Good. Okay. Let me tap this.
Ah.
Okay, gag.
Oh yeah, it was coming.
Okay,
Yeah.
So gag reflex is intact. That's cranial nerve 9 and 10 is intact, and also the soft palate rises symmetrically, and the uvula is midline. Okay. And I want you to raise your shoulders against my hands. Good, let go. And then as I push on your face, turn towards it.
Okay.
Good, and the other side. Good. So we're testing for trapezius muscles and the sternocleidomastoid. Those are intact. That's cranial nerve 11. 8. Okay. And I want you to stick your tongue out. Move it back and forth. Good. Okay. So that's cranial nerve 12. That's intact. I want you to raise your eyebrows. Squeeze your eyes real tight and keep them while I try to pull them apart. Good. Okay. I want you to show me your upper teeth. Show me your bottom teeth. Smile real big. Mouth round. Okay. Puff out your cheeks. Okay. Good. You can stop. All right. That is cranial nerve 7. It's intact. And then I also want you to, for cranial nerve 12, puff out your cheeks and push your tongue against your cheek. Okay. Good. Chesting for strength, and that's good. Okay, and then won't do any more auburn things. Okay, so I want you to repeat after me. I love pepperoni pizza.
I love pepperoni pizza.
Okay, so articulation is good. That's cranial nerves 5, 7, 10, and 12. Okay. Was any, all right, so now I want you to, I'm going to go ahead and listen, I'm going to go ahead and observe your anterior chest. Okay. Normally I would be looking at the skin for any abnormalities. I do know you because you're my family, so I do know that you don't have any abnormalities or any visible masses. I would talk about the skin, if it's warm, dry to the touch, any lesions or scarring that I might observe for any past surgeries, which I just know that you have not had. Okay. And then I'm going to, I don't see right now any heaves or lifts, but I'm going to palpate for pulsations or thrills. Okay, and I don't feel any thrills or pulsations. The patient's respiratory rate is even and unlabored, does not appear to be in any respiratory distress, right?
No.
Okay, now that we know.
Nope.
All right, now I'm going to ask you to say the words 99 when I put my hands on your chest, okay? Now?
99, 99, 99,
I did it too many times.
99.
Okay, so normally we just do it 3 times. Good. So that's tactile firmness, vibrations are felt equally throughout. Now I'm going to percuss. Okay. Okay, and I would do this bilaterally, again following systemically the ladder pattern. The sound is resonant throughout, or I hear resonance. Now I'm going to listen. I want you to take a deep breath. Deep breath through your mouth. Good. Good. And one more. And again. Good. Lung sounds, I don't hear any adventitious lung sounds. Breath sounds are vesicular throughout. Again, I would do this bilaterally. I'm also going to listen and auscultate your carotid artery for any bruits, and then I'm going to listen to your heart sounds, okay? Okay, I don't hear any bruits. Alright, so I'm going to listen to your aortic and pulmonic, second pulmonic, and tricuspid, and the mitral. Okay, good. And I have to do it with my back as well. So one more time. The aortic. Good. S1 and S2 is good and crisp. I don't hear any murmurs, rubs, or gallops. I don't hear, again, I didn't hear any bruise of the carotid arteries. Okay. Okay, so now I'm going to ask you, we're going to go ahead and do your deep tendon reflexes, okay? So, I can't even get my hand around your arm. All right. Okay, and we'll do your wrist. Turn your...
This way?
Yeah. Okay, you can't see that. Okay, good. And want your elbow out for me, or hold it up, sorry, like this.
Like this?
Yeah, and just let it dangle.
Okay.
Even though it's kind of heavy. All right. just relax. Okay. And then I'm going to do your Achilles. One time. Okay, good. And we'll do the, do this now. No, can't see. We'll do the Babinski and you lay down so that they can see. Okay. So we have done that. I'm going to ask you to touch your chin to your chest. All right, look up at the ceiling. Look over each shoulder. Good. And try, without moving your shoulders, touch your ear to your shoulder.
Not quite.
Yeah, that's good there. Okay, so we've done flexion, extension, lateral bending, and rotation. And range of motion, again, is full and expected. Okay. Let's go ahead and I'm going to look at your, we'll do the abdomen. So I'm going to have you lay down. Or actually stand up for me real quick. And you just face the wall. Okay. All right, this is good. All right, take a deep breath in, out. Okay, chest expansion is good. It's symmetrical bilaterally. Now I'm going to again ask you to say the words 99 when I put my hands on your back, okay?
Sure.
Now?
99, 99, 99, 99. Good.
Okay, tactile firmatives, vibrations are equal throughout. I'm going to percuss. And again, I would do this bilaterally, but for the sake of this, I'm just going to keep going down the side. Okay, good. Don't hear any abnormalities. I'm going to auscultate. Actually, first, I'm going to ask you to take let me do this before you do anything. Okay, take a deep breath in and hold it. Okay, let it out. And hold it. Let's do it one more time. Sorry, take a deep breath in and hold it. Okay, and then let it out and hold it. Okay, so. Okay, so diaphragmatic excursion, the diaphragm descends approximately 4 centimeters. And I have to do one more thing too, sorry. I'm gonna palpate, or not palpate, but I'm gonna look for CVA tenderness. Okay, and so when I tap my hand, I want you to tell me if you feel any pain, okay?
Sure. No.
Okay, no pain. I would again do this bilaterally. There's no CVA tenderness. All right, you can look at me, and we're gonna test knee flexion. So I want you to just kind of do a squat. So I know you just got out of CrossFit. And just stand up. So we've done flexion and extension, and you can go ahead and sit back on the table. And then I want you to swing your leg in and then out. And out. Good. All right, so we've done inversion and eversion. Okay. Now we're going to go ahead and can lay back. Great, good. So I'm again, I would usually be on the patient's right side. Well, maybe I can, let's see, it's auburn. All right, I'm going to listen to your heart sounds again, once with my bell and once with my diaphragm. Okay. good. And let's take my bell. Good. Okay. I again don't see any jugular vein pulsations, and would normally I can actually see a little bit from here, so I would normally measure this and would expect that the vein distension is no more than 8 centimeters. Okay. I don't see any pulsations. If I were looking for peristalsis, I would be observing the patient's abdomen for several minutes. Let me put your feet up. Sorry. There you go. That's probably better. All right. Also, I already said pulsations, and I don't see any visible masses, so any signs of enlarged organs. I would be looking at the skin, the umbilicus. Umbilicus is not bulging. I would expect it to be midline. Okay. Now I'm going to go ahead and listen. Good. So the bowel sounds are normoactive throughout. I'm going to go ahead and percuss. Okay, good. I don't hear any dullness. So I would be looking for abdominal reflexes. However, I can't physically see them, but he says that
They're there.
they're there. Okay. Now I'm going to go ahead and also percuss the liver. So, all right. Okay. There we go. Okay. And my hand. All right. I want you to place your finger right here.
Where?
Right here.
Finger?
Yeah. Caught your pinky. Yeah. Okay, and sorry. Okay. So the liver is 6 centimeters. Now I'm going to go ahead and do light palpation. And tell me if you feel any tenderness. Not so much.
No. No.
Okay. I'm going to deep palpate now, okay? Any tenderness?
No.
Okay. Now I'm going to try to palpate for the liver. However, I'm pretty sure I'm not going to be able to do this. Not the liver, the kidneys. Yeah. Do you feel any pain? Okay. I also do not feel them. This side. Okay, and I want you to, they're not palpable, but there's no pain. I want you to roll into your right side. And I'm going to try to palpate for your spleen. Okay, so just relax. Put it under your hand. Okay, not palpable. Okay, you can just lay flat again. All right, we're going to do a couple of things. I'm going to have you bring your knee to your chest. Okay, and back out. And I want you to extend your leg down over the table, if that makes sense. Perfect. So just keep it straight, though. Okay, and down as much as you can. Like while keeping it straight. Does that make sense?
Oh, like this.
Yes. Okay. Good. So you can put it back. So now we're looking for hip flexion, hip extension. Okay. Now I'm also going to do. I want you to just take this leg and move it on across the other one.
Like that?
Just swing it.
Like this.
No, just like swing it across and it'll come back. Good. Okay, you can let it go. And then move it out away from the other foot while keeping it straight. Okay, good. And come back. All right. And then we're going to do the same thing with the other leg. Okay, go ahead.
Which one?
That either one is fine.
Like that?
Yeah.
Okay.
And then just swing it out and then swing it back in. Okay, and in. Perfect. Okay. So we've done abduction, adduction, and flexion and extension. I want you to, again, bend your knee up. Okay, just rest it. All right, and I want you to kind of like tilt your heel like you're kind of digging it into the table. All right, and as I try to straighten your leg, I want you to hold your heel flat.
Okay.
Okay, good. So extension strength is good. And then I'm going to try to push down on your leg, and I want you to push it out. Okay, good. All right, so flexion strength. Oh, and then pull your knee up like you're pulling it toward your chest again, and I want you to rotate your foot in, good, and then out. Perfect. All right, put it down. So we've done inversion, okay. And I'm going to palpate your radial pulse. Okay, pulse is 2+, just relax your arm. I'm going to palpate your brachial. Drink all that coffee. Your pulse is 2+. I would also palpate here for the femoral artery and inguinal, horizontal, and vertical lymph nodes. I'm going to listen for any bruise, okay, at the aorta. And renal. And the iliac. And again, I would do this for the femoral arteries. I do not hear any bruise. Bend your leg up to me one more time. I'm going to feel your, and just rest. I'm going to feel your pop with your pulse. Okay, pulse is 2+, your dorsalis pedis. Good. Good. And your posterior tibial. Okay, and all 2+. And then we're going to do, look for the plantar flexion. Let me see your other foot. There we go. Okay. Let me do this one more time. Okay, so Babinski is negative. Plantar flexion is downgoing, and that is good and normal. Okay, I'm going to ask you to point your toes towards the wall and point them down towards the floor. And point your heels in towards each other and out, away from each other. Perfect. All right, you can put your feet down. I'm actually push against my hand. Again, push against my hand. All right, perfect. One more thing. Bring your legs together against my hands. Good, and bring them apart. Good. All right, so we've tested strength again is 5'5" throughout. I would be looking, I'm just going to look right here, at the patient's legs. For hair distribution, hair is distributed normally. There's no swelling or edema noted. I would again be looking at the patient's entire leg. There's no, I do not see here any lesions or scarring or abnormalities. I'm going to palpate your ankle and your foot, okay? All right, any tenderness?
No.
Okay, I don't feel any bogginess, there's no tenderness. I'm feeling also for calluses and bogginess also, or tenderness at the ankle joint. And then I'm going to feel all the way up the feet to the joints. Feel any pain or tenderness? No? Okay, I don't feel any unusual bony structures. There are no calluses. Skin is warm, dry to the touch. Check your capillary refill. Capillary refill is less than 30 seconds and good. Okay. And okay. And I think we can go ahead, you can go ahead and sit up for me. Okay. And I would be looking at the knees for any redness, swelling, or any abnormalities. Also with the muscles and the hands, feet, any atrophy or fasciculations of the muscle. I'm going to palpate your knee. Tell me if you feel any pain.
No.
Any pain? Mm-hmm. Okay, good. Okay. Now we are going to, we have done your, I need you to close your eyes, and I'm going to put something in your hand, and I want you to tell me what you think it is.
Some kind of gauze.
Okay, good. You can open your eyes. Testing for stereognosis, and that is positive. Now I want you to use your hands and do them back and forth on your thighs as fast as you can. Okay, good. You can stop. All right, and then I want you to, turn back towards me. Sorry, I have to be turning all around. Take your finger and touch my finger, and then touch your nose as fast as you can. Okay, good. You can stop. All right, so point to point is good. Passive movement. Okay. All of that. And so now I'm going to just think for just a second. Okay, just I'm gonna have you stand up for me. All right, and I want you to bend and touch your toes. All right, and bend back as far as you can. Good, and I want you to rotate without moving your hips. Okay, good, and then I want you to bend to each side. Okay, so we've done lateral bending, rotation, flexion, and extension. Okay, I want you to walk to the door and walk back. All right, so gait is intact. Turn smoothly, hand swing symmetrically at the patient's side. Do walk heel to toe to the door. Good. And then come back on your tippy toes and walk on your heels. So we're also looking again for plantar flexion and dorsiflexion. Good. All right. Stand with your feet apart and close your eyes. All right, normally we do this for about 30 to 60 seconds. I'm looking for any swaying. You can open your eyes. All right, now put your feet together and close your eyes again. Again, looking for any prominent swaying. We'll do this for about 30 to 60 seconds. You can open your eyes, and what I want you to do is put your hands out in front of you. And when I ask you to close your eyes, I want you to just tap your thighs one time and then bring your hands back to the same resting point. So
Okay.
Close your eyes and go. Good. Okay, you can open your eyes. All right, so that's testing your, where your position, I can't think of the word. And I think that we're done.
I'm very healthy. Thank you.
You're welcome. I feel like I'm missing something, but I don't know. Okay, that concludes our head to toe assessment. Thank you very much.
Yep.